Hello and welcome to the Evidence-Based Practice Overview module. My name is Liz Barksdale. My email is on the screen. If you have any technical difficulties with this module or general questions about the content, please feel free to get in touch with me.
You should be able to speed up these videos in MediaSite a little bit with their controls. Just make sure you can still understand me even if you got my voice going faster. There's some conceptual knowledge that you might be tested on for IRAT, GRAT in this section, in the next little section of the module about the hierarchy of evidence. So just pay attention and remember the main ideas. The flow chart that you're going to get in D2L is also a helpful document. It'll be a little bit more helpful in the second section of this module, and I'll talk more about it there, but that's just a little FYI.
On the library's homepage, we have a guide that you can refer to at any time that goes over the basics of evidence-based practice. Here we have a little bit of history about evidence-based practice and also a diagram that shows it's the intersection of three things: your clinical expertise as a healthcare practitioner, the patient values, and the best research evidence out there. Now, here's an example. Say you have a patient who is suffering from sleep apnea and he hates wearing a CPAP machine. So he comes to you and says he read about a little fan he can put up his nose. You do some research and you find that there is good literature out there saying that this can work for some patients. So you tell him to try it out, and he sleeps better, he's being compliant with it, and his test results are better. So that's taking into account the needs of this particular patient, what you know from working with patients day in and day out, and then going and finding this best evidence. But how do you know that the evidence is good? It's mostly what we're going to cover in this module: how to current best evidence in making decisions about the care of individual patients, in the words of Dr. David Sackett here. So there are 5 steps to evidence-based practice. The first one is converting the clinical puzzle into an answerable question, then accessing, searching to find the best evidence to answer the question. Those are the 2 we're going to focus on. Later on in your term,
You'll learn more about study design,
and you'll probably get into
particularly appraising
evidence to decide if it's reliable and robust. Then applying the information is extracting the useful information for the individual patient or the population you're looking at. And then finally, assessing is like the quality improvement meta step where you evaluate the process. So those are the 5 A's of evidence-based practice. And again, we're just going to focus on asking a question, quite a bit about accessing the evidence, and just a little bit about appraising, some basic tips about that. The first A is for asking, so let's talk about the 2 types of clinical questions. First, we have background questions, which are the more straightforward ones. They can be answered by textbooks, review articles, resources like UpToDate, which is a really good online reference that has a lot of current information because it can be updated digitally. So check that out if you haven't used it before. But a background question is like, what are the early symptoms of diabetes type 2? Something that you can look up and find the answers for in a pretty straightforward manner. Foreground questions, on the other hand, take a bit more investigating, and they form the essence of evidence-based practice. So you usually start with a patient, and we'll look at some examples of the foreground questions, but we use a framework called PICO with these, and that helps by clarifying the question, identifying what information is needed to answer it, and helping to identify some search terms.
I've talked to Dr. Dalton about this, and he said that sometimes med students want to know why they need to learn the terminology for background question and for foreground question, because it's kind of an implicit thing that you just learn as you're learning all these other things about medicine. But you can waste time if you are looking for answers to your question in the wrong place and just going a little too fast and diving into, say, PubMed when you could find the answer to your question in UpToDate. So that's why we want you to just know the terminology, know a little bit about it, and there may be an IRAT question, GRAT, IRAT question or two that is asking, is this a foreground question or a background question? So just make sure you kind of know the differences between what the two entail. So here's a little more information about background questions, just that they ask for general knowledge, that they can be answered in a textbook, review articles, tools such as UpToDate. And you might waste time if you are looking in a published study instead of one of these background sources. So a little example there is, what is mindfulness therapy? You can find a definition there. Another example might be, what's the best way to test for sleep apnea? Something where you can find quick answers, kind of best practices or quick definition. These are usually simpler questions, just kind of like a simple sentence or phrase. That seems like a straightforward question. With foreground questions, there's going to be a bit more involved in the question. So here we have a quick foreground question example that reads, in hospital staff, does mindfulness therapy reduce stress? And with that, you're not just asking for a definition of mindfulness therapy or summation of what it is. You're talking about a particular population and whether or not this type of therapy can create a better outcome for them. So we'll get into PICO in a second, but it just involves a bit more. And for that kind of question, you'd probably want to go into PubMed or Google Scholar at least, or somewhere where you can find more specific research studies on this particular topic. And if you can't tell the difference between a background or foreground question, you can start by looking at background information and then see if you need to go on further. Another sign that a clinical question is a foreground question is that you can use the PICO mnemonic to help you answer said question. So we'll get into that.
Today we're actually looking at PICO M, and we'll talk more about the M later. It's just a variation on PICO where we look at the best study design for the type of question we're answering. But with the main PICO, patient or problem is P. It can also be population sometimes for any public health people. And I is intervention or indicator, so that's going to be what you're trying to do for the patient, whatever the case may be. And then C is control or comparison. And you don't always have search terms for C. If it's a control, a placebo, don't have something under C to search for. Same thing with outcome. It's often implied what the outcome is. You want your patient to survive or get better. And sometimes with certain types of questions, you do want to play around with searching for words that are terms that have to do with the outcome, but not always. So that's just a heads up about that. But you pretty much always have at least the P and the I, the C and the O are sometimes translated into search terms and sometimes not. I'm going to be using two examples throughout this module. This one is my demonstration, and there's another one that I'm going to give to you to use for practice, so you can do one on your own and play around with it. And both of them are related to musculoskeletal disorders and problems. So for our example, we have a patient, she's 62, She's got a 1-year history of wrist and hand pain, and she's been self-managing with a wrist brace, but she just did a lot of activity, cooking a really big meal all day, and now she's in a lot of pain. The brace is no longer helping, and she is scared of seeing the doctor. She told you that she was hesitant to come, but she thinks physical therapy could help her even though she's scared of surgery. So to translate this into a clinical question, I'm going to take a little leap with this one, trying to phrase it maybe like a patient would. However, you with your clinical expertise would figure out that she has carpal tunnel syndrome, so we can put that as her condition. She's a patient with carpal tunnel syndrome, and we're wanting to know, how does physical therapy compare to surgery for improving pain and function? And here is my PICO chart for this clinical question. I don't have the methodology yet. We'll figure that out in the next section. I did write down the outcomes that we'd like to see for the patient, but I don't think I'll search for those because that probably is implied, but sometimes you have to get into a search and play around with it to see. And on that note, this is your practice scenario that you'll use throughout the module as we go through some little exercises. And it might not be the most straightforward evidence-based practice PubMed search prompt in the world, but it's a real life type question that you might get from a patient that can be a little bit hairy, so that might not be completely straightforward. So just play around with it, and this is supposed to be a learning experience to get a little bit of familiarity with some resources and know they're there through the library and through the medical center. In scholarly activity and frontiers in medicine, in future years, you'll get more in-depth practice and experience on this, but this is just to start to feel comfortable. Please go to the next part of the tutorial and write a clinical question for that prompt and fill out the PICO as best you can. We'll do methodology in the next section.